facing, we do know that there are several areas that create a lot of inefficiency in the healthcare system. There are 750 billion spent in unnecessary care around the world. 10% of the cause of mortalities are due to adverse drug event, so that can be avoided. And there is also 27% of the patients admitted to hospital due to deem avoidable decisions. So this is creating really a huge cost of readmission, cost of errors, and we know that many of these mistakes can be avoided. So this is not just a big cost, but it's also affecting the daily life of clinicians. So clinicians today, and we talk most of the time about the second age of healthcare professional, and this burnout is also due to increasing documentation, increased technology that is not set for purpose, and a huge pressure to make decisions very fast, with the risk of having a risk on accuracy in care. So we see also that there is a big push to use new technology, but this needs to be grounded in trustworthy content. So there is a high demand for standardization in care, and this standardization in care should be grounded in trusted clinical information. So this is in India even more, I would say, visible, because the healthcare segment goals, such as standardization of care, monitoring more the data of the patient, the integration is still not, the deployment of technology is still very fragmented. The healthcare IT ecosystem is broken in many parts between outpatient and inpatient care, and there are no guardrails, and this is true also in the US, between balancing speed and accuracy of information. So this provides a risk on the care that is provided, and the pain persists in the delivery of care. So our vision as Wolters Kluwer is to try to really step up, and particularly thanks to the AI technology, to build a clinical intelligence that can be the central nervous system of healthcare. So Wolters Kluwer and UpToDate have provided since many years the clinical decision support to AI-enabled and generative AI search. And we can provide this type of information more integrated into the workflow. Not just to start from the EMR, but not just that. We are really testing also in ambient environment this possibility. And why UpToDate is so uniquely positioned to provide a safe AI answer to the physician? I want just to give you a flavor of what has been happening in the last 30 years before moving to the future. So in the last 30 years, UpToDate has been created and has been building evidence-based content through the contribution of more than 7,600 doctors around the world in all medical specialties, through practicing doctors working in the best hospital around the world. And this has been a tremendous success, because as of today there are more than 3 million doctors using our solution in 190 countries, more than 700 million of time per year. And there are studies from Harvard University per year in India, across 400 institutions, which, if you just make basic calculation per day, you have 30,000 patients that are treated consulting UpToDate, and probably 10,000 patients per day are treated differently based on the best medical evidence-based medicine. So impactful, but your population is so wide that we cannot just imagine if these solutions are adopted at the central nervous system of the healthcare system of India, how much more population can benefit of this. So it wasn't easy for us to step up in AI, because we needed to do it very information that is retrieved and provided to the clinician is right. And with that, I think we are turning to the second area in which we can provide support to the vision of India to improve the healthcare setting. So the number that you have seen are quite astonishing, right? 730 million of views of topic around the world. Can you imagine this data set, how can be beneficial for the hospital administrator, for the public department of health across the world to understand how clinicians are searching information into the system. We can really analyze all this wealth of data, and again, thanks to AI, but from a different angle, AI helping us